Well, summer's winding down and autumn is coming into view. And a young man's fancy, at least here in Washington, turns to the campaign trail and the upcoming midterm elections. For the private label industry, attention focuses on what the FDA, Congress, and the Supreme Court are going to do in the next 3 months before the candidates leave town to woo the voters.
And much may be at stake this year, too. Nutritional labeling is going through its final review. GMO disclosure is moving to center stage, with rumbles from states like Vermont and California. OTC rules and regs may be targeted for an overhaul, and problems abound trying to find ways to inspect and regulate overseas suppliers.
One source of concern, as always, is the Food and Drug Administration. Eric Winborn is PLMA's eyes and ears in Washington and monitors the FDA, among other agencies, for his clients. Hi, Eric.
Hello, Jodi.
So the FDA, what's it up to?
Well, as your members know, the FDA in part is responsible for food safety and food security. And right now they're specifically working on updating the nutritional labeling regulations. These are very old regulations. And also the FDA is trying to implement the Food Safety Modernization Act.
I understand that there's talk of an overhaul to the OTC monograph. What can you tell us about that?
Jodi, you are correct. The FDA is trying to modernize the over-the-counter drug medicine monograph system. And what they're doing right now is working with the public and accepting public comment. They're working with various agencies and associations like the Consumer Healthcare Product Association. And I would guess it would probably take a couple years before we have a new monograph system in place.
And nutritional labeling, what's the status of that as we go into the fall?
Well, Jodi, that's a good question. Right now, the FDA is working again with various interested parties, accepting public comment on the regulations. And these regulations are something your members should be vitally interested in, and I would encourage them to go to the FDA website to learn more about it. These regulations will have a big impact on how labeling is done for serving size, calories, and also added sugar.
Can you give us a quick look at the Food Safety Modernization Act?
Oh, yes. The FDA is still trying to implement the Food Safety Modernization Act. And right now, one of the big issues is funding. And the administration and the White House had asked Congress to approve about $250 million in user fees to help implement food safety. Unfortunately for Congress, they said, or unfortunately for the FDA will not get those funds. Congressional leaders said they wouldn't authorize these increased user fees. But nevertheless, FDA is still proceeding forward on implementation, and it'll be an ongoing issue here for several years.
Thank you so much, Eric.
Thank you, Jodi.
The U.S. Supreme Court also takes center stage in the fall, as decisions are often announced in cases that work their way up the ladder from lower courts. Bob Vosburgh reports.
Brian, the good news is that the cases working their way up the judicial ladder don't appear to have any blockbuster impact on private label. One case at the appellate level pits the American Meat Institute against the U.S. Department of Agriculture. The trade group is challenging the constitutionality of the USDA's revised country of origin labeling requirements for meat, which mandate that labels indicate where the animal was born, raised, and slaughtered. The court will hold a conference in late September to decide whether to hear the case. Can California ban the sale of USDA-approved products from other states and countries based on production methods forbidden by a California law? Canadian producers of foie gras are petitioning the Supreme Court to hear their complaint against California, which passed an animal welfare law in 2012 that forbids the traditional practice of force-feeding geese to fatten their livers. Much to the relief of geese everywhere, lower courts have favored California's position. A third case working its way through the courthouse corridors seeks to answer whether the manufacturer of an over-the-counter cosmetic eyelash conditioner needs regulatory approval for its product. The maker of a prescription drug that treats inadequate eyelash growth as a medical condition sued the OTC manufacturer on the grounds that the eyelash conditioner is not in fact a cosmetic, but a drug. As of right now, there's no certainty the High Court will take any of these cases, but these three are typical of what faces the court as we go into fall. Back to you.
Thank you, Bob.
Congressmen may be heading home for re-election, but before they go, they either will or will not act on some far-reaching legislation. David Merrefield has this preview of what we can expect from Congress.
Well, Jodi, with more than 2,300 bills in the hopper, the 113th Congress faces a mountain of proposals before recess in October, so members can focus on their mid-year election campaigns. And in that mountain is legislation of interest and concern to private label. The most important is the contentious matter of GMO content labeling on food packaging. Depending on how a bill is worded, it could affect almost every private label manufacturer and retailer. Congress is being pressured to consider GMO labeling by consumer and environmental advocacy groups and may be pushed to act as individual states require labels. Vermont has already done so, and several other states, including California, are poised to follow suit. If the issue doesn't get resolved soon, it will perpetuate uncertainty, which could, in turn, throw the issue into courts. Some members of Congress may like that result since it gets them off the hook. Less well known is a controversy about the use of the chemical BPA in plastics and resins in the manufacture of food containers, plastic tableware, and storage containers. There's some scientific evidence suggesting that BPA can leach out of such products and be consumed, causing deleterious effects such as cancer, birth defects, and a host of others. The FDA has not ruled about this, although it has banned BPA's use in baby bottles and other infant products. A bill called the Ban Poisonous Additives Act has been introduced by a Democrat in the Republican-controlled House. The bill would ban the use of BPA in most food packaging and require the study of possible hazards related to BPA's use in manufacturing processes. But its chances of passage are slim. There can be many more issues that affect private label hiding within the mountain of bills sitting and awaiting consideration. But this Congress is on track to pass the fewest number of bills since World War II, so little is expected. PLMA's Washington conference, which will be held October 6 and 7, will focus more light on what Congress is or is not going to do. Back to you.
Thank you, David.
Let's not forget consumers. They have their organizations hard at work here in Washington and an agenda of subjects they consider urgent. Michael Jacobson is Executive Director of the Center for Science and the Public Interest. Hello, Michael.
Hi, Brian.
Michael, what's on consumers' minds this year?
When it comes to health, obesity and the calorie content of foods are at the top. And when we're trying to think about diseases other than obesity, the two biggies are salt and added sugars. There's a lot of controversy, activism, legislation on those issues, and surveys show that those are top of mind for consumers.
From the center's point of view, what is the most important action that you want coming out of Washington?
Probably the most important thing that the Food and Drug Administration could do would be to limit the sodium content in packaged and some restaurant foods. That would save tens of thousands of lives per year due to lower rates of cardiovascular risk. I don't think the FDA is going to actually limit sodium. It's talking about setting targets that companies should meet. And that's something the FDA certainly could do. And let's see if that happens. What probably will happen will be for the FDA to finalize its proposed food labeling changes, changing the nutrition facts label. And those will be important steps, I think. We don't know exactly what the FDA will do, but including added sugars on the label, much bolder calorie contents, and numerous other changes. Congress should pass the Food Labeling Modernization Act, which would tell the FDA to improve the nutrition facts label, to define natural, to add caffeine to labels, to tell people what percentage of whole grains are in foods that claim to be made with whole grains. Not much moves through Congress, so we're not counting on anything. Congresswoman DeLauro and Senator Blumenthal have proposed a tax on soda pop to reduce consumption and increase funds for health programs. Unlikely to pass very soon as long as the Republicans have this no new taxes insistence. But, a lot on the agenda, and let's hope that at least some things move ahead to inform the public better and protect the public's health.
Thanks, Michael.
It was my pleasure. Thanks for having me.
Well, we can't leave out the White House. Michelle Obama has put new attention on obesity and nutrition. Tim Simmons has this report.
Jodi, Michelle Obama is crystal clear about what she wants to accomplish as First Lady. She aims to change many of the grocery products sold across the country by reducing the amount of sugar, fat, and salt in them. At the top of her agenda this fall is making sure that the FDA's proposed nutrition facts label becomes a reality. She's even the one who first announced the proposed label changes at a press conference held in the White House earlier this year. Mrs. Obama believes that the new nutrition label will allow parents and consumers to pick an item up off a store shelf and quickly tell whether it's good for their family. However, her campaign to promote nutritious foods goes beyond the proposed label changes. She's also putting a high-powered spotlight on retailers who she feels are helping promote healthy living. Mrs. Obama publicly praised Walmart when the retailer announced a 5-year plan to lower salt, fat, and sugar in thousands of its products. And Walmart executives were not shy about declaring that the First Lady inspired the retailer's program. Two other major retailers, Walgreens and SuperValu, are joining Walmart in supporting another of Mrs. Obama's pet projects, the elimination of food deserts in part of the country where access to fresh groceries is poor. All three chains have announced plans to open stores in places where people lack grocery stores with fresh fruits and vegetables and meats. But retail stores aren't the only places where Mrs. Obama wants to make a difference. She will be pushing for more nutritious school lunches. The First Lady is currently battling attempts in Congress to roll back some of the incentives for better school nutrition contained in legislation passed a few years ago. Back to you.
Thank you, Tim.
PLMA will put the spotlight on the FDA and the other agencies of government on October 6 and 7 at PLMA's annual Washington Conference, which will be held at the Grand Hyatt in Washington. Speakers include Bill Schneider, well known for his stint as election analyst for CNN. Mark Baum, Senior Vice President at FMI, will give the briefing on food industry issues. Dr. Richard Steck, Vice President at Perrigo, will do the briefing on health and beauty. For the insider view of Congress, U.S. Representative Mike McIntyre of North Carolina will be on hand.
That's some list. Who's going to be the dinner guest?
Well, as you know, we've been very fortunate in our speakers over the years. FBI Director Louis Freeh, CIA Director George Tenet, columnist George Will, Bob Woodward, who wrote All the President's Men. This year, our dinner guest will be General Wesley Clark, former NATO commander and military commentator.
Wow, you're going to have to practice your salute.
Yep, here it goes.
For Brian and myself, we'd like to thank you for watching, but we also want to say to register for PLMA's Washington Conference, contact us at 212-972-3131 or email conferences@plma.com, and we will see you next time.